Hi, it's John Morris, CEO of Forever North Partners again, and I'm having the opportunity to have a discussion today with our Chief Human Resources Officer, Greg Wilson. Greg, good to have you here.
Good to be here, Ja. Good to see you.
Greg, give us just a quick backgrounder and areas that you've worked in.
Sure. So I'm a lifetime HR professional. Really have been in HR since I graduated from college. I started off as a trainee, worked my way into HR management. I became a vice president of HR when I was 32, and progressed through various positions to the chief HR officer role. Worked in various industries during my corporate time. Also served on the board of directors for Arizona Children Association. I've been consulting now for about 12 years. We certainly have extensive experience in the life science area, medical facilities, and so forth. And so we are involved in all aspects of human capital management.
We brought you in because of your expertise back, quite frankly, in this area, because we're going to be doing, and I have done some work in the area of clinical research. But there's a lot more to it in that area, especially when it comes to how we work with our doctors, how we work with the staff, how we work with the patients that are coming in, and those types of things. If we were to start a clinical trial where we knew we were going to be interacting, obviously that's usually the three areas where there's interaction. By the way, right? Is the doctor, the staffing, and the actual patients who are receiving the care. What might be your normal way of looking at something like that, and how you would begin to ensure that everything is correct in the human resource side?
I would say that every entity will be different. We've worked in like spaces before, and every particular entity has sort of their own preferences, the way they do business, their own different culture. And so the first thing we do is really get to know the client and really adapt to their needs and their wishes. And we really become an extension of their organization. You mentioned so that they don't get in trouble. Compliance is always the key area for professional HR, because there are just numerous employment traps, really on a federal level, state level, and our job is to ensure that we uh, develop the programs, the policies, and more importantly, the behaviors that really comply with federal and state laws, so that all their hard work and their investments don't go down the tubes, because all it takes is one employee to really file either a regulatory or a legal complaint. And there's a lot of plaintiff attorneys out there that are looking for really low hanging fruit. And I will tell you that in my 12 years as really in this role in the consulting space, we have not found one client that has been fully in compliance. Not one. Yeah, it's the reality is that it does take work, and you've got to really balance that work for compliance with their abilities to operate quickly, smoothly, efficiently, and achieve their objectives. And really, all that's done through policy and training of policy. So there's a lot involved, but we ensure that the doctors, the supervisors, and the employees understand the policies and practices, understand the consequences if policies and practices are violated, and really understand the rewards when policies and practices and certainly performance really when those levels are achieved. So we really take a holistic approach working with clients.